Your doctor is watching your blood pressure, your cholesterol, but what about your bone health? You may not think about it until, of course, you have a problem. That's when we always think about things. Sure. But getting a bone density test could also catch other issues before they happen. 9 News health expert Dr. Payal Kohli joins us now. So let's first of all go to the nitty-gritty, the bone density test. What is that? I think you kind of go, woo, what are you going to do to my bones?
No, easy. It's an x-ray, and they check usually at 2 to 3 spots. So they check the spots that are most likely to break. So they check your hip, which is called your femoral neck, usually on the right side, but if you've had any kind of surgery, they'll do the opposite hip. The low back, because you can have these compression fractures. You know, we've all seen those older people that are a little bit hunched over. Mm-hmm. That's where the vertebral discs are actually collapsing because they become like toothpicks. That matrix becomes super weak. And then they usually check the forearm to see if you have a risk of having an arm fracture. And you know, osteoporosis is one of the most common conditions as we get older. In fact, if you're over the age of 50 and you're a woman, you have a 50% chance of having a fracture in your life due to osteoporosis. And men have a 25% chance over the age of 50. So it really is a silent disease because we don't have any symptoms until we break that bone. And we all know that breaking a bone as an older person can be not just obviously painful, but disabling.
Right. And so what I love about talking to you about these issues is you always try to say, do this so that you can prevent that from happening so we never get there. But at those numbers, 50% for women, 25% for men, is there anything we can do to, you know, lower those odds?
There's plenty we can do. And that's where it's always glass half full, because if you know your bone density score, you can actually start to do things. Now, even without having a low bone density, most of us should do weight-bearing exercises, get enough vitamin D, which is one of the biggest causes of actually melting our bones. If our vitamin D levels are low, our body releases a hormone called parathyroid hormone that melts our bones to liberate that vitamin D. So making sure our vitamin D levels are nice and replete, making sure we're getting enough dietary calcium, not necessarily taking calcium tablets.
I was going to ask about that.
Yeah, and then weight-bearing exercises. And so I'm talking not just about walking, but walking hard so that your heel is slapping the ground, doing tiny jumps, you know, of course, lifting weights. These are all things that you can do to build your bone. Now, I will say in the modern era of weight loss medications, I'm extremely concerned that many more Americans are going to have osteoporosis. Oh. Because one of the things that predicts risk of osteoporosis is having low weight, having a low BMI, and we know that many of these weight loss medications, you have less meat on your bones, therefore the bones are gonna get thinner. So I want both of you guys to go home tonight, and as you're having your dinner, I want you to calculate your FRAX score. That's a little scoring system that tells you what your risk of having osteoporosis is, what your risk of having a fracture in the next 10 years, and if it's greater than 8.4%, then you may need a bone density scan.
So how do I do that? Is it FRAX? Like, do I go online?
FRAX. Yep.
Okay.
And you put in all your factors. So we'll talk about the risk factors. So every woman over the age of 65 automatically gets herself a bone density scan. Men over the age of 70. Now, many guidelines are saying they automatically.
Men, it's older, huh?
Yeah.
Okay.
Yes, because their biomechanics are a little different. Their bone density tends to be higher. If you've ever had low testosterone or any testosterone blockers, or a woman who's had premature menopause, where her menses stopped early, you've used chronic steroids, or you've had a prior fracture, these automatically buy you a bone density scan. But if your FRAX score is greater than 8.4, you don't have these, but you have risk factors like drinking more than 2 alcoholic drinks, or that's not you, yeah.
Drinking more than 2 alcoholic drinks in what period of time?
A day. Generally.
Oh,
so just having a high dose of alcohol, smoking, you know, obviously some of the other things we talked about, being sedentary, these are all things that in modern life do raise our risk for having osteoporosis.
So Google it and do the FRAX score.
And report back to me.
I'll do it tonight.
Okay.
All right. Doctor, thanks.